In this video, a leading prosthodontist from Costa Rica talks about full mouth rehabilitation.
Will be when patients have a poor condition of their own teeth where their teeth can be restored, meaning a patient that has been grinding their teeth for many years, they have a lot of cavities, broken down teeth, and they will need, in order to restore their bite and their smile, they will need a full set of crowns. It's called a full mouth rehabilitation over porcelain crowns. And then we have the cases that are more complicated and which we've actually specialized ourselves to, and we enjoy a lot to do them because they're very defying, which is the full mouth rehabilitation, where the patient has no teeth or they need to have their remaining teeth extracted because of periodontal disease or with very poor condition that doesn't permit for these teeth to be restored. A full mouth rehabilitation over dental implants offers an array of options. Depending on a patient's condition, depending on a patient's expectations, and depending on a patient's budget as well, which is very important to consider. The basic full mouth rehabilitation starts at removable dentures, similar to the conventional dentures that a patient will use, with the advantage that it will have clasps. It will have female and male attachment in which you actually clasp that denture to the implant. So it will be a similar denture to the one that you wear conventionally, but has the palate is going to be free of acrylic, so it's going to be less invasive, it's going to be less plastic within the mouth, but also the retention that this denture has is 1,000 times compared to a traditional denture. So the type of foods that the patient can ingest, the satisfaction, not having that feeling that their teeth are always going to come loose if they're in a meeting, or if they're in a business meeting, or if they're in a family meeting, they have that confidence that their teeth are always going to stay in place and that they can eat whatever they want. This is how it starts, and we will place 4 implants either on the top or on the bottom jaw or on both. Then we have an option which is superior from the first option because it's fixed, it's not removable as the initial option. It's a similar material because it's also done in an acrylic material, but it's not removable. Again, this requires 6 implants on the upper jaw and 5 implants on the lower jaw. We will do a gold bar that will attach all these implants together, and then we will do an acrylic screwed in denture on top of these. And the biggest option that we have, it's the option that actually is the one that it looks and works as good as the natural teeth, with the disadvantage that it needs more bone height, so it doesn't apply for all the patients. Our best-selling rehabilitation will be the middle option, the fixed hybrid dentures that we just discussed. But the porcelain bridge, which is the third option, it's a great option, but it doesn't apply to all patients because it requires so much bone, it requires a lot of bone, and it requires 8 implants on the top and 8 implants on the bottom. It's great because the bridges are going to be made of porcelain. The feel of them is going to be just as natural teeth, and it has the advantage that the porcelain, from all the 3 materials, is the one that is most resistant towards wear, towards fracture, and it's the material that will keep its color over time for the most because it won't stain. The other materials are also very tolerant towards fracture and towards stain, but the porcelain is always going to be the best material out of the 3.
Dental Implants Costa Rica facilitates affordable, quality dental treatment at world-class international hospitals and clinics. Fill out the free estimate quote form on our site, www.dentalimplants-costarica.com.